Okay, so this is a great chart that you have in Cameron. And so it's just kind of helping you put the thermal versus the non-thermal um, reasons why you would do one over the other as far as the impairments. Remember when we talk about the international classification system in the old method, they would talk about the impairment, and now we talk more about dysfunctional limitations. So if you have soft tissue shortening, obviously it's going to affect the way you move to get dressed or to walk. So kind of remembering that, or delayed tissue healing, prolonged inflammation, you're going to have that pain, which also is going to impair your function. Okay. So the effects, we have the thermal, you're going to use much more for that soft tissue shortening because we know it increases your soft tissue extensibility. Your duty cycle, remember we want it continuous, so continuous means 100%. The depth of the problem is going to depend on the tissue. So let's say you're more superficial, say like the patella tendon, you're going to be using that 1 to 2 centimeter depth versus if you want, like you had the quad itself, you're going to do more of the, it's going to go in about 5 centimeters. And so in order to get the deeper, you're going to need to have that frequency be at 1 megahertz, right? And if you're going to do the superficial, you're going to want that frequency at 3 megahertz. And we know that with the 3 megahertz, it heats up. Remember from our graph that it heats up quite a bit faster. So you need to have that intensity quite a bit lower. And so here they're starting at 0.5 watts per centimeter squared. And we talked about not going any higher than 1. And then the 1 megahertz, also remember with that picture that we had and how it shows it goes deeper, but the heat doesn't raise as high, and so you can put the intensity quite a bit higher in order to get that same effect. So I usually start about 1.2, so you're going to see this difference in different places, so anywhere from 1.2 to 2.0 watts per centimeter squared. Now the duration of the treatment, it's interesting here that they put 5 to 10 minutes because remember when we are in there did 2 times the area as we talked about of the sound head. But if we look at that formula, 5 minutes is probably not going to give us any therapeutic effect, even at 1.5 or 2 watts per centimeter squared. So you really need to realize why you're doing it and if you need to actually increase the amount of time that you're doing your treatment. And so then with the non-thermal, now you're doing a 20% duty cycle. Remember we said that was 2 milliseconds on, 8 milliseconds off. You have the same thing with the depth problem, so you're going to have the same parameters as far as the frequency. It's going to be 3 megahertz if you're going superficial and 1 if you're going deeper. And then with pulse, we always go at a lower intensity, anywhere from 0.5 to about 1 watts per centimeter squared. And again, you're not going to do more than 2 times the surface area of that transducer head. Okay. Fracture healing, we talked about this. It's a low dose. It's a special little machine. It's all set up. They do it about 20 minutes a day. It's pulsed and it's at a very, very low dose. And it's just to kind of help those non-union fractures. Dermal ulcers, again, like we talked about, they do it around the area. They can do it with something over it or in water. Now we do much more of this mist ultrasound. There's right here a little video that you can watch. You just click that on and it can show you what's going on with the mist therapy, and it's very beneficial, and there's good research out there for that as well. So we talked about that, the heating effect only lasts for a certain amount of time. So we know with the 3 megahertz, it lasts about 4 minutes, and with the 1 megahertz, it lasts about 7 minutes. So we want to do those things that are going to help with that extensibility, optimally either while we're doing it or right immediately after. So you could easily have somebody doing this, having your assistant or your aide helping you while you were doing the mobs along while they were heating that up too. I've done that a few times, pretty effective. Surgical incisions, those parameters, again, it's lower, it's the more superficial as we talked about, it's pulsed, and you do that for 5 minutes, and they actually do that almost daily if you're going to come in, okay? Contraindications, malignant tumors, pregnancy, central nervous system tissue, cement, plastic components, so we're talking about those total hips and total knees, pacemakers, thrombophlebitis, DVT, don't want to throw a clot, eyes, reproductive organs, decreased sensation, and mentation, which should be in here as well because they can't tell you if they feel a burn, decreased circulation, you don't want to go over the pelvis during menses, infection of the heart. New studies show that metal is okay. It's interesting, boy, when I was in PT school, that was a big no-no, but I know somebody was saying even on the board now, that's like one of the questions. So just to remember, that's not a contraindication. Precautions, acute inflammatory phase, obviously you could use the pulse setting, correct? Epiphyseal plates, because we don't want to affect the growing of that. Same with the fractures and breast implants. We don't want to impair what's going on there. Adverse effects, that's burn. We were kind of talking about that. You get that periosteal burn. You can get blood kind of coagulate in one area. And obviously you can get cross-contamination infection of patients. So you always want to clean that sound head off with alcohol before you use it on another patient. Okay. Phonophoresis, we talked about that. It's just a special kind of medicine that we get, an anti-inflammatory, and it's pushed through with the ultrasound at a pulsed rate. It talks about the advantages, which you'll probably want to know for the exam and to know why we would do this. So it definitely avoids any kind of those side effects that you might get from anti-inflammatories or pain pills. Avoids the liver. You don't have to have any pain from injections, no infections from it as long as you clean the sound head. And now they found that if they take this to the pharmacies and they get the compound made very specifically, and then it's much more effective. But it's still, you have to get through that skin, so you want to make sure the tissue's clean and that you're using the right parameters to push that medicine in. Okay, so it's a pulse setting, 3 megahertz, intensity from 0.5 to 0.75, and again, I would say 10 minutes based on that equation that we talked about, 8 minutes at least. So original studies showed the drug totally blocked ultrasound waves, so now that's why we do this compound pharmacy to make it more effective, and now you get about an 80% transmission, and it really does. I have patients that really seems to calm down, like if they have a patellar tendinopathy, something like that. It really seems to be beneficial. Okay, treatment parameters. 5 to 10 minutes is recommended. It's dependent on the size of the treatment area, the intensity, the frequency, and the desired temperature increase. So we saw that on that graph, right? This really is about 3 times faster, so why we have to be careful about that. And just remember this 5 to 10 minutes recommended. And remember when we looked at that formula that it looked like you had to have at least 8 minutes for you to get that temperature therapeutic effect. Number and frequency of treatments. Acute, a low intensity or pulse ultrasound. Remember in the acute inflammatory, we're really wanting more the non-thermal effects to not hinder that original inflammatory phase. So he talks about that first 48 hours. Okay. Chronic, you want to alternate days. They have done studies now that, I don't know how many have been AIDS and people just do ultrasound forever. But really, if you do more than 14 treatments, they're showing that you get decreased red blood cells and white blood cells. So you really shouldn't be doing that. And if it's not changing their symptoms, they're not getting better, then you really need to reevaluate and reassess. And that's where you might want to just talk to the physical therapist.